County Administrative Office. Our next topic is appointments for the Garbage and Recycling Advisory Committee.
Yes, thank you so much. Well, good morning, Chair Harrington, Board of Commissioners. My name is Mira Samantal. I serve as the Director of Health and Human Services. I use she, her pronouns. I am pleased to introduce Kathy Folsom, who you have met before. She is our Senior Policy Coordinator with Solid Waste and Recycling, which is a division within Health and Human Services. And Kathy will be reviewing the options for committee member appointments for GRAC, as we call it.
Thank you. Good morning, Chair Harrington and Commissioners. I'm here before you today to discuss potential committee member appointments to the Garbage and Recycling Advisory Committee, otherwise known as GRAC. So the Garbage and Recycling Committee is a committee appointed by your board that includes members of the community and an industry member. It's charged with providing advice to your board on solid waste related issues. The membership is comprised of 8 voting members representing the public and 1 voting member representing the solid waste industry, as well as a non-voting member who is the Solid Waste and Recycling Division Manager. So we have 10 positions and we had 3 vacancies. There was a public member open vacancy and a midterm public member vacancy, and then an industry member who was seeking reappointment. We did some broad-based engagement over the last 6 months to try to promote the vacant positions. Specifically, in addition to the boards and commissions media release and recruitment efforts, we also promoted it on our social media, the GRAC webpage. We promoted it with community partners and with our volunteer groups, such as the Master Recyclers. We put it on our Facebook. We even used LinkedIn and the Hauler Association, and we went to Metro and promoted it with their work groups. And
You did it all.
we tried. And following the recruitment period, we were in receipt of 4 applications. After interviews with staff, 2 of the public member applicants formally withdrew their applications, leaving us with 1 application for 2 public positions and then the application for the reappointment by the industry member. Pursuant to the applications received and based on our interviews, we are recommending appointment of the following individuals. Elizabeth Teagan, she lives in Washington County. She's a managing director with PricewaterhouseCoopers. She's hopeful she can contribute to policies that maximize waste diversion and improve sustainability. Vinod Singh is the industry member. He works and lives in Washington County. He's employed by Far West Recycling as an outreach manager, and he served as the industry member on the GRAC since 2020. He's interested in helping the materials management system stay healthy and grow into the future. We're recommending that Elizabeth and Vinod be appointed for a term that would expire in March of 2029. We are continuing to recruit for the midterm vacant public member position, and will hopefully be back before your board in the near future with an additional recommendation for appointment. And that concludes my staff report. So if you have any questions.
Thank you, Ms. Folsom. Commissioners, any questions or comments?
Eyes wide open. You got another bean counter on this.
No comments. Like
That thumbs up for me. Yeah. So I think from the sounds of it, we're all ready to proceed.
Wonderful. Yep, May 27th for an action item. Thank you,
Terrific.
Kathy. I will stay up here since the next item also is part of HHS.
Great. Turning over to 911 emergency medical transportation rates.
Thank you. Well, just in case we have people tuning in just now, again, for the record, my name is Mira Samantal. I use she, her pronouns. I'm the Director of Health and Human Services. With me today is Adrian Donner, who's our supervisor. Well, she's not physically with me today. So Adrian is taking advantage of the option to call in to help protect the health of our folks in the room. So thank you, Adrienne, for demonstrating good public health practices. But Adrienne is still going to be the one leading the presentation, and she's a supervisor with our Washington County EMS program. We also have momentarily in the room, Rob McDonald, who's our regional director with American Medical Response, or AMR. I did see him in the hallway, so I know he'll be coming in shortly, available for questions as they arise. So with that, I'm going to go ahead and operate the clicker, but I will turn it over to Adrienne for the verbal presentation.
Thank you. Thanks, Chair Harrington and Commissioners. Sorry for the remote access, but I'd be really more sorry if I was in the room with you, as you can hear. I want to just cover what I'll be covering in this session. I will also acknowledge that Tim Case is also online, just in case my voice doesn't hold out for the presentation. I do believe in a backup plan. And then with Rob and Jen in the room, they will likely be able to answer any questions that you have if I'm not the person who should answer them. I want to give you a little background in the current situation, talk a little bit about our system, just to remind you of how things work, talk about the proposed rates and a little bit of comparison, and then our recommendation for this as well. Thanks. So the background, in Washington County, our system is a fee-for-service system, which really means that the only income that our 911 transport agency gets for providing that service in the county is the fees that they charge the customers. This is not the only way to do business in emergency medical services. There are many counties or cities across the nation that choose to go other routes to supplement income to subsidize the system, but it is one of the systems that is used as well. In the Tri-County region, all the EMS systems are a fee-for-service system. Next slide. We have a regular process for doing the rate increases year by year, which have a formulary in the franchise agreement. And if we're able to use that formulary, it's a regular, an ordinary rate increase, a pretty simple process of plugging numbers and moving forward. If AMR requests an increase outside of that regular and ordinary increase, then their information comes to the EMS program for review and assessment, and then we bring it to you, and ultimately the final decision rests with you. So much like in previous years when the rate increases came to your board each year. Next, thanks. So historically, since this new franchise agreement, we've had 3 rate increases. The first 2 were actually done in preparation for this franchise agreement, with the September of 2023 rate increase just being an update to the mathematical formula of 3 times the Medicare rate. Then last year, when we went through the rate increase, it went with the standard ordinary and regular rate increase, so it didn't come to your board. Next slide. So what is being requested now is a 3-year rate increase schedule. These are beyond the regular and ordinary increases, and they go on a % increase basis. So this year, starting in July, it would be 13%, with the second and third years being 30%. The profitability of the Washington County AMR unit only happens in year 3. So it's a slow build up to a profitable organization in the Washington County AMR. Next slide, and I'm going to pass this slide to Rob, assuming he's sitting at the table now.
He is Adrian. I'll go ahead and
Perfect.
pull that up, Rob. Thank you. And you can introduce yourself too. as well.
Good morning, Chair Harrington, Commissioners. Nice to see you all. On this slide, we're going to detail a little bit about what the rate increase really results in. EMS is a unique industry in that any rate increase is only really realized in the private insurer market. As you guys know, Medicare and Medicaid is a capitated payment system. So we can charge $6,000, but Medicare will pay its standard allowable rate. As a result, the pass-through of any rate increase is typically felt around $6 to $8 per hundred in a rate increase, because all of those rate increases are impacting the private insurer. And the private insurer accounts for a smaller percentage of the total population of Washington County. I'm not a slide reader, so you guys are welcome to read the slide. But really what this slide's trying to tell you is, while the rate increases on the surface and the prior slide are showing you the 13, the 30, and the 30, the realization of the revenue to make us sustainable is only realized in a very small population of the Washington County constituency. Next slide. Little detail on who pays. As you can kind of see, Medicare and Medicaid, with accounting for 73% of our total transports, they're not affected. There's no way that we can go to the patient or family after Medicare or Medicaid pays and ask them for the balance. That's not legal. As a result of that low Medicare Medicaid reimbursement issue, EMS, not just in Washington County, but really all over the country, are struggling now. Wages, the cost of providing EMS care, particularly in an advanced system like this one, has far exceeded any rate increases that may have come from the federal government or Medicaid. Next slide. Yes, please.
About that, we have experienced across a range of industries that government has to work with, how the reimbursement rates through either state government or federal government have not kept up with the pace of cost increases. So I don't know what well, actually, you've given us the numbers for us to see the delta. But I don't know if the federal government has had a history of that gap, or if that gap between what it allows for the reimbursement rate versus the cost has just significantly escalated. Could you?
Yes, Chair, you said that actually about as perfectly as you could say it. Medicare has not kept up.
All based on assumptions.
Yeah. No, you did explain that well. The Medicaid rate fee schedule has not appreciated any increases that would substantiate or allow us to recoup back the increasing costs of EMS care. Good question. And as you can see before we go, the average cost for Medicaid and Medicare in this population is as follows: $597 for Medicare and $420 for Medicaid. Again, these patients will not be balance bill charged. So again, going the details down about really who pays, as we went back and I indicated private insurance and HMO accounting for 15% of our total transports. That is really the only segment of the population that's impacted on this, which is also the reason why the pass-through of any rate increase, i.e. for every $100, we see $6 or $8 total revenue and reimbursement back on that. We do have an uninsured population here, but thankfully AMR and GMR also have payment plans, and we're really interested in expanding compassionate care for Washington County and the citizens here. For those who don't know, compassionate care is a program that is typically funded by the EMS agency that will, for those qualified, and we will probably mark the benchmark at pretty high rate, 325 to 400% of what they would consider a federal poverty line in Washington County. That's often based off of what the cost is to live here. So we'll mark that as the benchmark to apply and become eligible, and in which case the patient's out of pocket is zero, and we are recouping that back with fees through either franchise or through other agreement with the county, and they'll reimburse us back. And this would be a net zero cost to the county if we did that.
So I'll pick up from here. Thank you, Rob.
You bet. I'll excuse myself. Thank you.
So just a little bit of information about the EMS market in general. So the three big types of systems are fee for service, what we in the Tri-County region have. Fee for service with subsidy. So there's a tax base of some sort that helps subsidize the system to keep the fees lower, or a fully subsidized system. This is pretty infrequent in the United States, but there are some other countries who do this quite well. The other piece of the market, of course, and you've heard me say it before, or if not me, you've heard Tim say it before, paramedic availability is a significant issue within the financial part of EMS, as well as the operations part. We see an ongoing national shortage of paramedics, so much so that there's quite a look right now at if we can import paramedics from other countries. And the supply and demand of that increases that cost as well. Go ahead and switch slides. So just to give you an idea of that supply and demand, this is the kind of national numbers, about a year old, of course, of the availability of paramedics. So you can see Oregon and California both have fairly low numbers of availability of paramedics. We also in Oregon have the unique academic requirement that only one other jurisdiction has, which makes it hard to bring in paramedics from outside of the state. There's steps that they can go through so it can happen, but it just takes a little bit more work. We can't just ask for them to come over the border from another state. Next.
So, before you move on, just to be clear, lighter is better.
Lighter is worse in this one. Thank you for that clarification. So the mauve color, the Oregon and California, is the second lowest category of accessibility of paramedics.
And Adrian, just so you're aware, the colors aren't quite as clear on our screen, so I think that
Sorry.
that's clarification. That's okay.
It is on these.
Oh, it is. Oh, you're right.
Yeah.
It is.
So the only ones worse are Hawaii and New Jersey.
That's accurate. And I believe New Jersey is the other academic state, but I'm not 100% positive about that. Okay, next slide. So again, supply and demand. Our supply is low, so the demand is high. And as you can see, the entire West Coast, including Alaska, we have the highest wages for paramedics. In this case, darker is better or worse, depending on your perspective. We have the 6 highest paying metropolitan areas in Washington and California. And those jurisdictions' wages range from $44 to $54 an hour. In the Tri-County region, Washington County is competitive with the other AMR jurisdictions. But even with that, if you look at these rates across the West Coast, their highest wage for a paramedic with 12 years of seniority is just shy of $42 an hour. So the cost of paramedics kind of continually pushes a budget, not to belittle the EMTs and others as well. You just didn't need too much data in this presentation. Next slide. So to our recommendation, we recommend moving forward with this proposed 3-year rate schedule. We will work with AMR to assess how to assess the need for future rate schedules after this based on profitability. So we want to make sure that if there's a rate increase, it's not just going to profit. In addition, as Rob nicely said already, we'll be working to enhance the compassionate care program so that we're limiting the effect of this rate increase on the people who are most detrimentally affected by it. Next slide. So of course, any questions you have are welcome, but also wanted to know if there is more information that you would need in a presentation, and if you want this presentation with any of that additional information at the May 27th board meeting for an official decision.
Commissioners, any thoughts on these two questions or others? Go ahead, Commissioner Snyder.
Yeah, a couple comments and questions, things I think need to be thought through and addressed. One on slide 6, when you're showing the sort of rates as they're proposed and not reaching profitability until year 3 here, those rates are nearly double the current rate with the percentage increases. And that certainly gets my attention, especially when we're saying that's what's required to get to profitability. And with that context, I guess my question, I don't think this is answerable today necessarily, but one really important factor driving the total cost is how much of the local operations are responsible for paying for national overhead. And you could make a profit or a loss look a certain way simply by adjusting how much overhead or sort of contribution is required to the national organization that AMR is, or any large provider. And I guess I would like to understand in the Washington County operation, when we're saying it's not profitable until the ALS rate is $3,293.68 per call for a base rate, what amount of that is contributing to national overhead that is not direct Washington County operations? I think that's an important thing to know. And I'm guessing the group here may not even be able to answer that today. But to me, it's an important question. If that is a large amount, that would get my attention. If it's a smaller amount, that would also maybe better support the rate. So I think that's an important thing to know and understand. On slide 8, I'd like to know, there's in the middle of that, an average cost to provide. Are you saying that's the average cost to provide what is that? The way it's labeled, I don't really understand exactly what is intended to mean by the average cost to provide. Are you saying that's your cost per call for an ALS call?
Yes, Commissioner Schneider, that's what that's indicating. That's our cost of providing that particular call.
Okay. And do you, with any, is that just the direct cost, or the, how much overhead or other things are in that rate?
So that's going to be a totally encompassed rate with all costs associated to include regional or national applications. And it's quantified and calculated on a per unit per hour based cost. So for transporting the patient and the time it takes from dispatch to transfer of care, that's our estimated cost for every trip.
And that's a good number. I guess I'll just point out as we're looking at this, and obviously you can tell this is a space I spend some of my professional time in, but the $742 as a cost, the Medicare and Medicaid rates there, you see where those are, and you see the volume. So we're talking about in year 3 of this proposed increase, almost $3,300 on sort of the non-government paid rates here to cover $742 cost plus profit. I mean, it's a wild, yeah. And I just want to make sure that's clear. The last question I have is about the potential financial impact of the using the nurse alternative disposition in the 911 center, and whether that whether you expect that will have some sort of a impact in hopefully in a positive way in what might need to happen to rates.
Thank you. Adrian or Tim, do you want to share or respond at all to that question?
Yeah, I can respond to the nurse navigator question. The hope is, of course, that nurse navigator will right size some of the calls that come into the 911 system, specifically the calls that aren't best served in the 911 system. I think it will take a while to realize any system cost benefit to that. Right now, the patients are receiving the benefit of better connection to care. But that it definitely is the hope of Nurse Navigator, is to reduce that unneeded burden on the actual 911 transports.
So that will be reevaluated in, I'm hoping that's going to be reevaluated in the rate conversation here, if it does have positive impacts.
I think not directly, but as the system moves forward, I laugh because we're evaluating the Nurse Navigator system almost constantly right now, but the effect that it has on the system and the call volume will be part of the conversation as we move forward with rates in future years, for sure.
What kind of efficiency, this will be my last question, but what kind of efficiency are you seeing in the operations in Washington County now? I know historically you probably use like a unit hour utilization ratio or something like that. What are you achieving in Washington County now? As far as efficiency, I mean, part of why things cost so much is how much resource you have deployed and how efficient or productive it is while it's in the field. So what are you seeing in that space right now in Washington County?
Yeah, thank you, Commissioner. To answer the question, I mean, first to the efficiencies that may or may not be realized through Nurse Nav, if I could address that first one. Thank you. We also are fully committed to doing profitability reviews. We're not trying to come in and make a ton of money here. We're trying to make some sustainability occur. And we would be more than happy to enter into, on an annual basis, profitability reviews with full transparency. And if we get to a place where efficiencies realized by Nurse Nav, or to your second question, efficiencies realized by simply improving the way that we navigate our system, if that translates into cost savings, that then subsequently translates into profitability to a degree that we can't pass a straight face test for, we're going to be transparent on that. In which case we would probably want to come back to you and say, this next rate increase doesn't need to be this. It could be this. And we want to do that. Absolutely. As far as efficiencies within the system, Commissioner, that's a great question. It's interesting to answer it in this way, in that this system, we're still babies in. I know it's been a little over babies in. I know it's been a year and a half. And I will lean into your experience in EMS, particularly. EMS systems don't evolve and change quickly. It takes time. The good news is we have an incredible amount of support, both through the EMS office with Adrienne and her team, our fire department partners. The word that we're getting is everyone's very pleased with what we're doing now, but there's more work to do. Those efficiencies will be realized through the dispatch system, to try and get the right resource to the right person at the right time. Still a lot of work to do there. There's probably some resource waste occurring with multiple dispatch ambulances to a single unit. But those are nuances that we're working through. And again, should we realize those efficiencies, and we will, and that translates into a more sustainable model for the agency providing, we'd love to come back to the table and say, these rate increases as scheduled, we're not going to need to that degree.
Thank you.
Any other commissioners?
Yeah, I can't get to where you want us to go. It'd be really hard pill to swallow to approve that much of an increase. You're putting the burden on 4.9%, if I'm reading the stuff correctly, of the uninsured. There's just plain not enough information here. We didn't have a staff meeting, or I didn't have a meeting in advance of this, so there's just not enough information here for me to understand this whole process. When you tell me we're going to double the rates and you only get 8% increase, that's about $120 per transport on a $3,200. So I mean, the numbers just don't work for me. So at this point in time, I'm a no, unless you can show me some other things. And I'd also ask for, I remember when we first were negotiating the initial contract with you guys, and the financial statements we got were consolidated conglomerate that were huge. I would prefer to see financial statements. specifically for Washington County. So if you can provide me that information by whenever time this comes to the board, then I might have a different conclusion, but right now I'm in.
I have a couple questions. Thank you for the presentation. As I look at this, first of all, could I be reminded when AMR started the contract with Washington County? Adrian,
Yeah, August of
August 20.
2023.
August of 23. Okay, and I'm looking at the historic rate increases on slide 5 that then moved into the current rate increase request. So we did have rate increases shortly after the contract was signed, and we're moving into this scenario. So that, frankly, I have questions about that. It seems to me that what I'm hearing is that the cost, the lack of recouping costs from Medicare and Medicaid is really the driver behind this issue. Okay. That given, I don't see a strategy around dealing with that issue either. And I'm looking not to our staff, but frankly to AMR for that. I don't understand what your strategy is in terms of lobbying, whatever it might be, because this has the potential to just keep getting bigger and bigger and bigger. And the bottom line is that the insured customer of yours is the one that pays the price here, because it's and consequently those insurance rates, and we pay for them here at the county, escalate. So that's the prism that I'm looking at this through, that I'm concerned about. I'm also concerned that I don't understand, and I think I heard both Commissioner Snyder and Commissioner Willie talk about this, that we don't have a real clear picture of Washington County. So, we previously had a local provider. We now have a conglomerate provider, and I can't compare apples to apples here. So so I'd be in alignment with understanding. So in order of, understanding the pressure from the conglomerate, understanding what it is that you are doing in relationship to solve the problem, and what that strategy is, as well as an explanation of a further explanation of the ramp. So I may need a briefing as well.
Sure, and if I may, Mr. Willie, you make some really good points. Thank you for saying it. What you've just described is the EMS industry. And you know what? You said it doesn't make sense. You're right. It really doesn't, Commissioner. It's a consistent struggle to maintain or build sustainability in EMS, whether it be a conglomerate private provider or a small or local provider. The Medicare rates are impacting on a negative basis. And you're right, as far as do we expect anything from the federal government in terms of Medicare relief? No, we do not. That said,
Sounds to me like it's going the other way, actually.
and given the current administration, who knows? But to your question regarding lobbying and efforts in Washington, D.C., we're very actively involved, whether it be through the American Ambulance Association or our rather large government affairs division, who works with Washington, D.C. and is consistently lobbying for Medicare rate changes.
I'd like to see the evidence of that, but thank you.
Understood.
Commissioner, anything?
Thank you, Chair Harrington. Rob and the team, thank you for your great presentation. I appreciate it. When I was doing my homework over the weekend and reviewing this material, I did have questions about the Medicare and the current administration and where that ship is heading. And I appreciate the answer that I heard from you around, it sounds like you're anticipating what that might look like. So that was a red flag that went up. I was like, oh my goodness, if the administration threat carries through
Mhm.
about cuts to Medicaid,
Right.
Medicare, what does that mean for us? And what does that mean for you as an AMR entity? So I'm I'm not asking for it. I'm comfortable with the questions, the answer you gave. I did, when I was reviewing the thing that caught my attention, the staff are presenting this information. I'm sure there's uh, the vetting process they went through, and I'm sure you've had multiple discussions. I'm comfortable with the first year review, and I was like wondering, why did you request 3-year rate increase schedule rather than 1 year?
Mhm.
And because I think with the financial situation we are this year, and county administrator proposed a balanced budget, but in that balanced budget, she had to address 20.5 million deficits. She, and did that wonderfully. I'm sure there was a lot of work, but for us, we saw 600 pages. So the 13%, it's something that is within that shortfall, but I don't know what 2026 will look like
Mhm.
in the anticipation of, and so on, so forth for 2027 as well. And 30% going from 13 to 30% seemed a bit of a steep. Um, so I wanted to have more discussions about that. I don't know if Adrian, you could weigh in on how you got to this formula here to this year schedule and what your vetting process. Because I think if you all with our county administrators speak to this and alleviate some of the concerns I have about that, I'm happy to support and give a thumbs up here. But I did notice the 3-year schedule, and I said, oh, whoa, should we have a more, because, and frankly, if Medicare takes a hit at the federal level, it might be 50% to you, right? Like, the rate might be. So we don't know what the realities look like, and that is true for Washington County. 2026 budget cycle might be different.
Right.
Yep. Let me
Right.
start first just to pull apart the county budget and this conversation. So this agenda item doesn't affect county budget at all. The EMS program has a pretty set fee that comes in from AMR to pay for the program as it is with a regular escalator. So these increases don't affect the county budget at all.
Okay.
And then I'll pass to Rob.
Thank you, Adrian. To answer your question on the 3-year schedule, it's important to note we will be taking losses in year 1 and 2 under the current schedule as proposed. Losses on our estimated for the P&L and our forecast will have a net loss before taxes of 1.79 million in 2026 if the rate increases were approved. Year 2 will take a $906,000 loss, and for you, Commissioner, that would be including any regional allocation costs that we're on the hook for the larger corporation. And in year 3, our forecast would indicate profitability at 457,000, only after all 3 rate increases.
So my final chair is that the slide about average cost to provide is 742.
Mhm.
What's every year then? So 13% versus 30%. How does that follow the 3-year schedule?
In terms of the
cost to provide
cost to
stay
provide.
the same?
We will anticipate costs to increase. They're going to increase in the wage packages for our paramedics and EMTs per the labor contract, of course. The cost to purchase an ambulance has gone up 27% in 2 years. Medical equipment, both durable and non-durable. Their current, I think the inflation rate for non-durable is 6%, and for durable medical equipment, it's 13%.
But it's not going to go, the cost on that slide, it's not going to go 13, 30, and 30.
Negative, it will not. What those increases are getting us to is to a sustainable model in year 3.
Oh, okay. Okay, I think I've asked enough questions for
Great.
now, and we'll just keep an eye on, because I think as residents, and especially people who are um, emergencies happen in our community, and if I'm uninsured and utilize EMR services, I'm concerned about the bills they're going to get as a, in, but I'm sure there's some programs out there with you about
Correct.
to alleviate that and to avoid some bad credit.
Yes, ma'am. Yeah, compassionate care, and then we do have several payment programs that we can work with for folks on the uninsured side.
Thank you.
So if
When you're
I
done,
could-
yeah, when you're done, I'd like to just make one other point.
So, to give me an opportunity through the cycle, I first want to make sure I wrote down a fact correctly. And Adrian, I'm not sure I did. I don't know, Adrian or Tim, could you remind me of when did we move the franchise over to AMR?
Yeah, August of 2023.
Okay. Thank you. I did capture that right. So, a few things. I did note on slide 11 that it's, or you say in the bullet, Oregon has the unique academic requirement of an associate's degree for paramedics, blah, blah, blah. So that is a state of Oregon requirement.
Correct.
I think it might help us to say that as opposed to just refer to Oregon as the geography, because it's clear around where these requirements reside. And I'll come back to that point. I first want to start with the comment that I was really pleased with the multi-year effort that we went through to set up the EMS Alliance and go through all of the requests for information and proposals to put together a contract request, put that out to bid, and so forth. And it has led us to where we are now with the ALS, BLS, and Nurse Navigator. So that was quite an effort and quite a context. I also want to say thank you to our staff for providing us with the memo on April 8th that included the opportunity for us to have one-on-ones prior to this work session. What I am having to lean back on versus, I'd like to share a comment because I have some questions. I think it may help us when we ultimately make a decision with regard to this A rate increase, is to answer the question of what are the detrimental effects, potential detrimental effects to the three categories of customers, as well as our fire department partners. You know, I have a lot of respect given especially the history of forming the EMS Alliance and looking at response time problems. It led us to all of that cumulative effect led us to the current contract, the current construct, to make sure that the needs of our community are met. But there continue to be challenges nonetheless. And so I appreciated the slides. All of these slides were very impactful, but I think when we go towards the decision making, it would help, I think, to tell the story of, well, if a company isn't able to do this per the contract, where does that leave our community members, right? Those who have no insurance, those with private insurance, those with Medicaid, example. It's not that I want to imagine that reality, but it speaks to the level of concern and careful decision making that I believe my colleagues want us to be making. So I don't know what you have in your treasure trove, Adrian and Tim, to help us understand that. But I'll look forward to that. So when it comes to the reimbursement level that is provided for Medicare, Medicaid, I'm wondering to what degree that's on AMR to lobby versus Washington County and AMR. And really, I don't remember the context of what does the system look like here in our state. And I know we went through that, but I apologize because I didn't go back to our portal to dig out those presentations and remind myself of that. I do know through information with Multnomah County and Clackamas County that they're struggling with level of service for customers as well. So this is a very difficult space. I can empathize with the situation that Commissioner Willie was pointing out, but at the end of the day, across our nation, there are people who need ambulance response. And it seems to me like I can imagine that the reason why the state has this academic requirement is because it speaks to patient level of care. But at the same time, if there's nobody showing up because of the lack of workforce, that's a pretty detrimental effect too. So I think independent of working on a 1 year or a 3-year rate increase, I think I understand the basis for the 3-year and accept that. Not a problem. I still don't like the fact that the numbers work out the way they do for everyone involved. But even if this board were to make the decision May 27th, I think we still need to take on the work to change the landscape. I think there's some additional project work, if I could just label it that needs to be done. And I don't know how well, the starting point is for us to request that that be investigated. Then lastly, my question is, if we delay this decision beyond May 27th, I'm wondering about the effect short term, given the difference between the current rate and year one. So I don't know if the contract allows us to delay, but I see a 13% rate in year one versus continuing on with the current rate. I mean, just continuing on with the current rate seems not acceptable, is not an acceptable plan B, in my opinion. So I don't know how to restate that as a question.
I think I understand your question, Chair Harrington. Adrian, can you address the timeline for this decision and the implications if it's delayed?
Yeah, and I have a few other nuggets that I have some answers for as well. So optimally, we would have a decision in place by July 1. And a decision could be varied, either the full 3 years or the first year or something, so we can do that rate increase update with AMR. To the point about how it affects fire, our fire partners, when they transport, which isn't very often, they use the same rate that AMR does, and they have the same barriers that they do too. Medicare, Medicaid is a national problem. And so they'll have the same benefit from the rate increase as well. To the who's lobbying, there's a lot of lobbying going on at the national level, and we have some key EMS folks in the region who go to the national level to advocate. And so there's no lack of voices. You know, as Rob said, AMR has a loud voice there as well. There, I'm not sure how optimistic the voices are at this point either, but they continue to kind of, you know, voice the concern of this barrier. There are areas of advocacy in Oregon as well. I would say, you know, we advocate in favor of the academic, as Chair Harrington, as you put it, it does provide a level of knowledge and skill to our providers. And so we're actually advocates of maintaining the academic requirement and working through issues. And Oregon has been pretty good about putting in stepping stones to new paramedics who come into Oregon, so that it's not a you have to finish this before you start. There are slow ways to get them on board faster and delay the education requirement.
Yes, thank you for reminding me of that. And I'm also really pleased that we have the ALS and the BLS response, and the pairing up of EMTs with paramedics versus requiring 2 paramedics. Yeah. I think that was a well-researched recommendation that you brought to us. I don't want anyone to walk away from this meeting thinking that I am suggesting we change the Oregon requirement, but rather really trying to be reminded of some of the context that has led up to this point. Thank you, Adrian, for reminding me of all that work that you and Tim and others worked on. Because I think it serves our community members very, very well. So at this juncture, based upon the presentation today, the memo, my having had a one-on-one, while I'm comfortable with moving forward with May 27th, we will come back to you, Commissioner Snyder. I hear that at least 2, if not more, of my colleagues would appreciate a bit more information and time. So I'm just going to recognize that, hear from Commissioner Snyder, and then come back.
So reflecting on the whole totality of this conversation and how ineffective the cost shifting model seems to be here, I guess I would really appreciate I'm just thinking, like, I think an out of the box solution may be the way to. I don't think increasing rates by hundreds of dollars to capture $5 or $6 or $7 is a smart way for us to operate. And I guess I would look to our team about whether or not there are alternatives. Like, could we charge, for example, an ambulance dispatch fee that would be, I don't know, $20, $30, that would then be able to be used to make this more viable? And it would not be a medical charge. So it's not something that, at least I'm just like, what are some out of the box solutions that might keep the system sustainable financially and not require a $3,300 ALS base rate to hope to collect an extra $100? Like, that just seems really ineffective.
So if I could paraphrase that, or
Sure.
summarize, investigating other revenue options.
Yeah. What is another way to solve this problem with a fee or some other alternative?
Yep. But I think that investigation is going to take some time as well.
I'm supportive of the year, like moving on the first year request. Like, I guess I didn't state that, but I'm okay with that.
Round 2 is open.
No, this just would you please provide, you say AMR is seeking an increase beyond the franchise agreement's automatic allowance, but you don't tell us what that automatic allowance is?
What is it?
That I saw. Yeah, so all I see is what their requested rate increases. What if we don't do that? What is the rate?
The current one, right?
Adrian or Tim, do you happen to have that handy? If not, we can follow up.
They can just provide it with the follow-up information. That's good.
Yeah, it's formulary. And so last year it was 5.7%. It's based on cost of living and a few and provider payer mixes. I haven't calculated it for this year yet, but we could get it calculated to add into the slides.
Thank you.
So, I'd like to ask a couple of different questions. I heard Commissioner Snyder comfortable with 1 year. Commissioner Fye, at one point you said you would be comfortable with 1 year, but you're also comfortable with 3 year. I know I'm comfortable with the 3 year, but I want to bring this back to a couple of different things. Do we have the option to, this is really for the board. Do you want to proceed with this 3 year proposal, knowing that there are a few other projects in parallel around investigating other revenue options, and frankly, just getting some further information for yourselves? Or do you want to direct staff to put together just a 1 year rate increase so that you can come back before July 1 of next year for the subsequent years?
Yeah, I'll just, as a comparative, I need to know what the automatic allowance would look like. I also think that the optics of a 91% increase over 3 years, which is basically not even 3 years, but is horrible. And if we don't do our homework and have lots of data in front of us to make this decision, then I think we are not paying attention to the users of this system.
I think it's a 1 year increase, but with a commitment to our partner in this, that we are going to work to make the system profitable and it's supposed to be, but there's more work that needs to be done around that.
Would agree with that.
And I am uncomfortable with a 3 year commitment. I am more comfortable with the 1 year commitment and working together. And Commissioner Snyder, I really like your idea of looking at, what are our alternatives here as well. So, and I also want to understand further what the effects of the conglomerate are on the local. I would appreciate that as well.
Commissioner Treese, do you agree with the proposal of proceeding with the 1 year authorization while working towards a 3 year, as Commissioner Snyder talked about, with profitability in mind for that 3rd year, as he?
Yes. Yes.
Commissioner Fine? I think you're the only one. I haven't heard this idea.
I'm okay given, I'm okay with the 1 year romp. I do stand by the staff. You all did a great job and did have stuff in boxes. So I'm comfortable if we go, as I stated first, the 1st year. Sorry, I didn't mean to put the 1st year on the table. Sounds like, but and I'm also comfortable if we go through the 3 year route, Chair Harrington.
So if I could reiterate, the option that's under discussion right now is to proceed with the 1 year proposal as soon as even May 27th, while continuing work together so that we get to the 3rd year that works towards profitability. But that will come back to us with further information. And we know for sure, and we know for sure it needs to come back to us before July 1 of 2026. That's what Commissioner Snyder suggested, and multiples of us have weighed in yes.
I can live with that.
Chair Harrington, can Rob ask a clarifying question?
I'm sorry, he's from AMR. You're bringing a proposal to the board. So are you asking me a clarifying question?
Only based off of the conversations that we've just had.
Okay.
If the contemplation is to consider a 1 year, what would the board feel about the 13% probably needing to be a different number?
Year one, you're changing the numbers.
If the 3-year build out plan is something that isn't palatable to the board,
So what?
we'd have to reconsider what a 1 year run the
Okay,
financial.
hang on for 1 second.
Sorry.
This proposal currently of 13-30-30, as you've referred to it, has the goal of working towards that state of profitability by that year 3 point. What we've talked about is committing to 13 today with that very same profitability goal.
How we get there might be different.
How we
Understood.
get there may be because of other revenue options, for example.
Understood. Thank you for clarifying.
Are we all on the same page?
Yes, Chair.
Okay,
At least I am.
I understand that. I understand that. And so
Clarification.
Show me the numbers and might be a yes.
I also heard a commitment from staff to get you some further information. You may still be at a no for this, but
We will
also know
return on May 27th, addressing the questions, following up with a proposal for just the 1 year, with that
with a 3-year
with the 3-year
profitability.
profitability goal, but not with those numbers pre-baked in. Does that sound accurate?
That then there's going to be work to do between.
Work
Correct.
with other revenue options. Okay. Okay,
Thank you so much, Chair Harrington, Board of Commissioners.
thank you.
Thank you.
Thank you all. Appreciate the time.
So at this juncture, it's 10 of 12. So Ms. Angie, I would ask, we're about 45 minutes behind schedule. What's the suggestion?
The suggestion is that we move into the Five Oaks update. We do expect this just to be 10 minutes because it's a follow-up to the information we sent. And then we would need to move item 5 after the lunch break to provide you a lunch break.
At 1 p.m. Because we have outside speakers on that, but 1 p.m. works. Okay. Thank you all for problem solving that.
Good morning, Chair Harrington and Board. Marnie Kyle, I'm ACA.
Ann Ober, also an ACA.
And I think we'll actually do this in maybe less than 5 minutes and get you out for your lunch. But we just wanted to come before you and review, reiterate the memo that we sent on May 2nd about the Five Oaks Museum. Just as a reminder and for public who may not have been hearing this information all along, Washington County received notice that Five Oaks Museum had closed due to inadequate funds, and they have been continuously closed since December 29th. As of April 7th, we did terminate the museum's contract with us, and that means that the building and collection have reverted to Washington County. Our facilities team performed all of the physical possessions, and so we are now in possession of the building, the collection, keys, and have been able to ensure that the building and the collection are secure. And our records team, who are here today, as well as Laurel from facilities, have done a preliminary, very high-level review of the collection and the documents. And what we learned during this review is that it is a very complex and vast, substantial project. And so what we're looking at is what are the legal requirements, what are the deaccession standards, the museum deaccession standards, what there are artifacts that have owners, and how do we identify who the owners are? Did they loan them? Did they give them? What has to happen with them? Are there collections that belong to Native American tribes that we have to figure out who and how to give those back? There are a lot of complications, a lot of the documents we would need to go through and make sure that we're maintaining them following public records laws. So it is very complex. In our first initial review, we've determined it would be quite costly and that it would likely take several years. So what I'm here to let you know today is that we have asked in our memo for more time for staff to investigate some different alternatives so that we can come back to your board late summer. And to me, that means by the end of August, and provide your board with some options for moving forward. And that's really what we wanted to share with you today.
And I would just add that we do have funding in the budget for this coming year that can be used towards the operations of the facility and the utilities associated with that. It's in the lottery funds where it has been historically.
You
So-
don't need operations where people can come visit.
No.
Thank you for clarifying. This is simply to make sure that the building stays secure, that the artifacts remain safe, and that we're able to do our due diligence during that time.
And during that time, or maybe it has been determined currently, that the outstanding debt that the museum took on is resolved?
We have been told that it is not, that the county is not liable for that debt. We did ask to receive paperwork associated with that debt, and we did not receive that paperwork. So at this time, we are believing the attorneys associated with the museum originally that the debt was taken on by the board of the museum and not by the county at the time.
And we did have a board member, a commissioner that was on that board. Is there responsibility there?
We have been told that there is no county liability associated with that at the time.
It's not the board that would take them. It'd be the organization.
The organization would, but how they took that debt, we are unsure of. They did not have any assets at the time to secure the debt against because we were the owner of the assets. So we've had some confusion about how that is being managed. However, without hearing from someone differently, we have done as much due diligence as we can without receiving the paperwork.
So the only observation I would make is that from a community perspective, broader community perspective, even though I think we're fairly confident that it is not going to be financially viable to somehow operate the museum as it used to be at one time, and the county is not going to probably be in that business, I think at least one of the alternatives needs to contemplate some sort of an operations of the museum simply so we have it for comparison. And that may mean a proposal when you're coming back with alternatives that proposes a community-based organization of a different kind or setup, operated, I don't know. But I think we're going to at least have to be able to say that we considered that and that we knew what that would cost.
Commissioner, thank you. And that we have had organizations come forward and ask that question. And I will say to date, not that it's off the table, but to date, no one has been able to propose any kind of financial model that even gets us close
Sure.
to a sustainable model of operating.
And I'm not surprised that's the answer. I just think we have to be able to say we did the due diligence around that.
We are definitely still open to that, but to date, we haven't had anybody come. A lot of people have come forward and asked for that solution, but there has been no finance plan that has supported that type of a solution to date.
As far as you know, there's no organizations or individuals that are still out considering finding the money to run this?
There have been individuals who have expressed interest, but no one has provided provided us with any financial capability or understanding for what the maintenance of the facility would look like. So we have not seen anything where it would be a staffed museum that would continue to retain and maintain the assets as they are today. Our biggest concern is making sure that there's no devaluation of the assets within the museum portfolio as well as the facility. So for instance, roof has to be maintained, that HVAC system has to be upkept, and those things do cost a significant portion of money. So at this time, we do not have a plan that actually, with full investment, would be able to manage what was being managed previously.
But we have kind of budgeted some money just to maintain that level.
We have. So we have the budget presentation that we'll be doing tomorrow has, I believe, about $180,000 included in the budget for maintenance of the facility and the assets and to start this work. We also have Joe Nelson here, and A&T has been focused on trying to figure out a plan. We would have to come back for a budget adjustment at a future date once we had a better understanding of the direction that the board wanted to go and the cost. But for the time being, the museum is secured, the assets are secured, the building is secured, and that buys us some time to make determinations as a team.
I was just going to add that the budget includes also a part-time limited duration contract staff, and it's an expert that was previously a board member, helping to work through what does the DS session look like and what are the artifacts, and it just getting us into their system that they had where they had done some inventory of the collection. So just so that doesn't surprise you, we also do have a part-time limited duration person that's working with Joe and his team.
Expertise.
Yes.
Correct.
Yeah. Question, then we'll shut up. It's Five Oaks is a nonprofit, standalone under their own board. Are they taking responsibility for the tax filing?
Yes. And their board leadership has been actually exceptional to speak with and work with, and I really appreciate the leadership they've been providing in this.
Is the board basically inactive right now?
It is, but the two chairs have been working through this process and have been working with others to assume whatever those responsibilities are and have been speaking with attorneys and accountants to get through the process.
Okay.
I'd like to thank you for this update because it has helped me internalize that the proposed budget includes approximately $180,000, which would cover the cost of maintaining the building and keeping the collection safe and secure as we move forward. And part of the reason why I summarize that is because given the volume of constituent interest and comment, one of the things that I did was try to look into what was the most recent available budget information or annual report from the museum. And it was a few years old, and it had a budget of, if memory serves me right, around $250,000. And so I was trying to figure out, well, okay, so they've been operating, maybe it was 2021. Anyway, it was a couple of years old. And so there was taking care of the collection as well as having their exhibits or programs. And I was having trouble separating those two and really trying to focus on what does it involve for us to carry this forward so that the assets are at least safe and secure. And now I have that clarity. Thank you very much.
I will also just extend that with, we've also done things like turn over the Wi-Fi so that we now have access in the building to be able to do the retentions and to figure out the assets on site. So I really appreciate just in this moment thanking the staff who have been highly involved. Both Fred and Joe have been incredible to work with through this process. And Laurel and Greg have, as always, done a yeoman's task of getting the building secured for future Washingtonians.
yet another responsibility that we've found ourselves needing to address on behalf of the community, and that our staff have been willing under Ms. Angie's leadership to sort out. So thank you very much.
A local one, but the Band-Aid.
Thank you.
Okay, we'll take a break and reconvene at 1 o'clock with topic 5. Thank you.